introduce the team from Apollo Children's Hospital to you all. So here is Dr. Rachna. She's a medical superintendent of Apollo Children's Hospital, and Dr. Saravanan. He's a nephrologist who treated the child, and our ICU team. So doctors over there, and here is Dr. Vasanth Kumar, and I'm Dr. Priya Vardhini, and I would like to introduce specifically Dr. Suchitra Ranjith, who is going to share the success story with you all. She is the head of the Department of Pediatric Intensive Care, and she's one of the known and international, national and international faculty, and she's very reputed.
That might have been fatal. Suddenly his liver failed, so we didn't know the reason, what the fever was. All the tests were negative, but all we knew was that in 24 hours his liver failed completely. And our team of doctors whom you met, we have 6 consultants and a large team of critical care fellows. Within hours, in front of our eyes, he was going downhill. And in 24 hours, we had to tell the family. So they've just brought a child with fever, right? Then next day, we had to tell them, your son will die unless he gets an emergency liver transplant. His group is O positive. It didn't seem too hard, but the family hails from a middle class background and they were totally crushed. What are you telling us, doctor? Our child will die. He was playing cricket yesterday morning. So, and as you know, liver transplants an expensive business. And the uncle said, Pesame, let's go home. We can't afford all this. So we had to sit with them and say, you concentrate on the child. We will help you raise resources. We will help you raise your, save your child. We are all in one team. Father, mother, doctors, everyone's in one team, and we have one goal, which is to save your child's life. At the same time, 20 lakhs had to be raised at a very short notice. And again, so in the status now was that he was talking when he came, but he was sleepy, and now he is deeply comatose. His brain is swollen up, right? It's a liver failure, but his brain is swollen up. His urine output stopped, and he is in kidney failure. All his blood clotting mechanisms, you know what is blood clotting? When you have a cut, the blood flows and it clots. That is what prevents the blood flowing and flowing. But that failed. When a liver failed, the blood clotting mechanism fails. So he could have had hemorrhage anywhere in the brain, in his lungs. So it was a very critical situation. And it normally is important for digestion, right? And sometimes when the liver fails, you can get jaundice. But can liver failure kill a patient? So yes, it can, and this is how. Because liver failure can release a lot of toxins. The liver is a nice, efficient filter. So whatever we eat, all the toxins in our body, it detoxifies, it filters, it prevents it going to the brain. So when the liver fails, all those toxins can go to the brain and the brain cells can swell up. The liver, a failed liver leaves the body at risk for many dangerous infections. They can have bleeding. The blood pressure may not be maintained. So this is how a liver failure can kill a patient. So each of these can cause death before the liver recovers. So you can see here, the patient can have malignant brain swelling, catastrophic bleeds, uncontrollable infections, circulatory shock, and then the end of the story. So all this can happen to a child with fulminant liver failure. So that is the reason we need to do a super urgent liver transplant before any of these or all together can cause a patient to succumb. Now, so we have seen here that many organs can fail, right? It's called multi-organ failure, which can happen in a few days. And where a liver is available, that's the other way the child can live. But the other, in a few patients, the liver itself can recover, okay? But before the liver recovers, so all those things can happen, what I told you earlier. So before the liver recovers, the patient can die. The patient can die of so many reasons. So usually the best way to guarantee survival is to do a liver transplant. But in this child's case, we were testing and testing. There was no liver transplant. Live donors, cadaveric donors, nothing was matching. So what did we have to do? So we had to employ something called a bridge to transplant or recovery. Remember that these may or may not work, because liver transplantation is a main guarantee. It's to guarantee survival in fulminant hepatic failure. We need a liver transplant, but there is no transplant organ. So we had to employ this bridge therapy. So our team of doctors and nurses in the PICU had one single aim. Somehow we had to keep him alive till a liver was available. And with constant input from Dr. Saravanan, pediatric nephrologist, he was placed on complete life support, employing the same high-end technology that was available in the best liver units across the world. I'm not sure if you have heard of a place called King's College in London. They do the highest number of liver transplants, both in children and adults, in the whole world. And we were in constant touch with the director of the pediatric ICU there, how best to keep this boy alive. So what did we do for this child? Very complex liver support. So you can see here, he's unconscious with his brain pressures and electric impulses being monitored. He was placed on a chemically induced coma. So we employed general anesthesia in the ICU and made him deeply comatose. And we did continuous Doppler monitoring of his brain blood flow and pressures. He was placed on continuous renal replacement therapy. So we remember I talked to you about some poisons that the liver filters. So these two machines, plasmapheresis and renal replacement therapy, also called CRRT, will remove those poisons. Okay, will protect the brain to some extent. And the plasmapheresis also tries to mimic the liver's own function, gives that good things to the patient, removes the bad things, something like a dialysis. But if the liver is producing even more than can be removed, this won't work. So we didn't know whether this will work or not. We didn't have a choice. So these are all temporizing, very risky, very invasive, and meant for a bridge to transplant. But we didn't have a choice. We just had to employ these therapies because it was literally between the devil and deep blue sea. Every day that passed could have been this child's last day, and still no organ was available. Suddenly, we began to witness an unfolding miracle. On day 6, he was receiving all these complex therapies. Out of the blue, his liver, which was totally necrotic, showed small, tiny signs of recovery. Right? Then later that day, we couldn't believe the lab test. We repeated again, and again in the evening, it was the same. It was getting little better. And slowly the liver recovered. And once that tsunami was controlled, the effects of that tsunami all over the body was controlled. His brain swelling decreased. His kidney function improved. His urine output improved. His conscious level recovered. And 9 days after admission, he was removed from the ventilator, and all other life support technology was discontinued. So you can see here on day 10 in the ICU, he's off the ventilator, trying to drink some water. His liver function was good, his urine flow was good, and he's alive. So on day 10, when he's better, a cadaveric O positive liver is finally available. And that time, you think we accepted or refused? Of course we refused, because he's alive and he made it. So this little boy's story is a super story of a family's trust that the whole medical team was going all out to save their child despite all odds. It's a story of successful multidisciplinary teamwork, advanced technology, and of course, blessings from above. I'm going to play this video here because he's a little shy and he might hide his face. The father sent this video of him living his future dream and with his sister and older brother trying to play cricket. So he's completely normal. He's not on a single medication and he's ready to go to school in another month or so.
Before that, can we have you just repeat in a small way?
All right.
Informal or somebody?
I think Dr. Priya and Vasanth can.
You can just repeat whatever she's saying in a very concise way.